We have on the line Dr. Amanda Doyle. She's from the NHS Clinical Commissioners, and she is also one of the commissioners in Blackpool, where only 2 cycles of IVF treatment are offered, despite, as I said, the official guidance being that women over 40 who are infertile should have 3 full cycles of IVF. Dr. Doyle, welcome to you and yours. Tell me how much you have saved then in Blackpool by reducing the number of IVF cycles that you're prepared to offer.
I don't know. Well, it depends on how many you would have otherwise funded. But the issue is that this is part of a list of really difficult decisions that CCGs are taking every day.
I mean, are they reasoned decisions, or do you just run out of money and cast about for something to cut?
No, they are reasoned decisions. So we're allocated a set amount of money. We know how much that's going to be, and we know how much the things that we spend our money on cost.
So
and it's our job to deliver a whole range of services to meet the needs of all of our local patients within that budget. And we have to prioritise, and it's not easy. And
so talk me through then how you decided in Blackpool, what you were weighing up when you decided to cut the number of IVF cycles from 3, as is recommended, to only 2.
So it's a balance between the financial position of a local area, the health needs of that population. So in Blackpool, we have the worst male life expectancy in the country. We have the highest death rate from respiratory disease. We have really, really high prevalence of poor mental health, of cancers, of cardiovascular disease. People die early and live less well. And we are trying to balance the needs of people with a range of diseases and illnesses and needing support against people with equal levels of need for IVF or other interventions. And so what we are trying to do is deliver the best outcomes we can for our population within the resources we've got available.
What makes one treatment, sorry to interrupt, more of a priority than another one? So IVF is less of a priority in the sense that what?
It's not less of a priority, it's just that within the overall list of things we have to fund, we have to take some decisions, and what we fund is 2 cycles of IVF. There is a range across the country in different CCGs making different decisions depending on both their population health need but also their financial position. We take into account things like NICE guidance, things like clinical evidence of effectiveness of treatments, evidence of population health needs. So different parts of the country will spend different proportions of their health budgets on different priorities depending on the health needs of their specific population.
Well, Professor Adam Bailon is our expert guest today. He's a consultant gynaecologist, chair of the British Fertility Society. Professor Bailon, you've heard what Dr. Doyle has to say, that there is a population with higher than average rates of cardiovascular disease, cancer, difficult decisions to make. IVF in those circumstances has been reduced from the recommended 3 cycles to 2. Do you think that's a mistake?
Well, I do think it's a mistake, but actually I think it's a very eye-opening statistic, and I think, in fact, Amanda Doyle has made the argument for us, because in such a deprived area with such poor health risks, they are able to fund 2 cycles, which is better than many CCGs that fund none, and the majority that only fund 1. So if Blackpool is so deprived compared with the rest of the country, and they can still fund 2 cycles, I think that's a real eye-opener. And interestingly also that she didn't actually know the costs, and I think that's something that is key. In fact, this afternoon I'm chairing a group in NHS England looking at a benchmark price for IVF so that it's equal around the country, so that we can remove the postcode lottery. And if I can come on to this issue of lifestyle choices, infertility is not a lifestyle choice. It's a disease, and it's a combination of many diseases.
Didn't say that. That's not something Dr. Doyle said.
No, it's not something she said,
but
it's something that listeners have said. I think Dr. Doyle made a very powerful argument for appropriate funding of IVF, and as I said, if she can fund 2 cycles in such a deprived area, why can't at the very least the whole of the country fund 2, and most, I think, could probably afford to fund 3.
Dr. Doyle, you do speak for all the commissioners, don't you, in an official capacity? Why, if Blackpool, which is a deprived area, can fund 2, can some fund none at all? Hello, Dr. Doyle? I think we've lost Dr. Amanda Doyle, have we? Or is she still there?
No, I'm still here.
Sorry, yes. We lost you for a moment.
Different areas are in different financial positions as well as having a different range of health needs. What's really important is that while we recognise the value of treatments like IVF and don't underestimate how painful this can be for people, it's still really very important that it's taken in the context of the whole health need and the whole system need for the population. What's equally important is that we are going to be having these conversations more and more if we don't attract some significant resource into the NHS.
Dr. Doyle, can you see a day when no one will fund IVF, given the way funding is going? That's what this latest research has revealed, that the cutting back of it, the cancelling of it, seems to be escalating.
I would certainly hope not, and that would be a great shame. But nevertheless, if we don't attract significant investment into the NHS, we're going to be having more and more of these conversations and not just about IVF.
Dr. Amanda Doyle from NHS Clinical Commissioners, thank you.